So I'm still with Lisa Kaufman. And Lisa, tell me about your background. How did you find yourself starting your own company in this field?
Okay. My story is a little bit different, which is kind of fun, I guess. My master's degree is in therapeutic recreation. I moved to Atlanta to do my internship at Emory University Hospital. Then I did work at Emory Hospital for a while, about 8 years. And the VA hospital, I worked in their nursing home for quite a few years as well. I got to this place where it was not as fulfilling as I thought it would be, because it was mostly procedural and there were a lot of bureaucratic requirements. It wasn't fulfilling in a lot of ways. At the same time, my mother, who is now retired, she's an RN, and she started a care management practice in the Chicago area because that's where she lived. And she was so excited about getting back to direct patient care without the hierarchy of being in the hospital system. It was extremely appealing. So I left the VA nursing center, went to Chicago, and I stayed with her for a few weeks and just shadowed her. Came back with her documentation that she had developed and her some of the procedures and forms that she had created. And I came back to Atlanta. This was in 2001, and I started my own practice here. Part of it was initially to try and get her to move to the Atlanta area because I had young kids at the time. It took her about 7 years. And by then I really knew what I was doing, or I thought I knew what I was doing. And had several employees, and we never really ended up working together. She really did retire about that time. But that's how I got introduced to this. I grew up listening to a nurse talk about patient care. She was a nursing home administrator when I was in grade school, and I used to go visit patients, and I was in a chorus and we would sing. It was just something that always appealed to me. And just having those conversations all the time, it just felt very natural. I think the thing that appeals to me most, not that you asked this, but I'm going to say it anyway, I love the advocacy and working directly with the patients. I'm not a real big fan of playing politics in a big hierarchy. That's part of why the VA didn't really end up working well for me. It always felt like it wasn't about patient care. It was always about the bottom line. And that just is inauthentic for me. So now it's about patient care, and I get to call those shots. And as controlling as that sounds, it's actually very freeing to really take the time to explore, what does this client need and how can we make that happen for a successful outcome?
That's great. It sounds like for you, it's more of a vocation. So many people do whatever they do because it's a job. They need a job. But this
is a career.
Some of us who are lucky and we do things because it's a vocation for us.
Absolutely. Absolutely.
So earlier you were describing, kind of the view from 5,000 feet, well, lower than that, but the work that you do and people in your field do.
Right.
Let's make this a little bit more. Can you give me an example of, I don't know if you're permitted to do that, but you don't have to identify anybody, or you can mishmash a couple of examples. But can you give me an example of something that maybe you've done, someone that you've worked with, and how you've engaged with them, so that maybe somebody watching this can put themselves in that place and say, okay, yeah, I can see how this could be helpful for me.
Okay. I actually have a lot of examples, but I'll try and give this one as a short example. I had a client, he was in his late 80s, early 90s when we started working with him. 2 children, one lived locally, one did not. They did not see eye to eye about dad's. Yes, it does. They did not see eye to eye about what dad's care needs would be. Dad had actually a history of mental illness that they didn't talk about initially. So that ended up being significant, but was brushed under the carpet. And the focus was on his physical needs, including he had chronic obstructive pulmonary disorder. So he had trouble breathing, and he had inhalers that he would take so that he could breathe more clearly. But it occurred to me in working with him that his anxiety kept going up. And this is not an uncommon phenomenon, that if there is somebody with breathing issues, not breathing makes us anxious, which is a vicious cycle. The more anxious we get, the harder it is to breathe. So at some point, you have to interject how to stop the cycle to calm down the anxiety, which improves the breathing, which and then spirals in a positive direction. So I suggested to the son, who was my primary point of contact in the power of attorney for healthcare, I said, I know we've never talked about this and I don't know what the history is, but your dad's got a lot of anxiety and I would love to see what an antidepressant would do, because at the right level, an antidepressant addresses anxiety disorders. And he's, no, dad's always been like this. We don't want to touch that, blah, blah, blah. We don't want him on any extra medications. I'm like, oh, yeah, okay. Well, things kind of blossomed again and came up, and I said, could we try this now? And he finally got to a place where he said, yes, go ahead. I'm like, I don't think it's going to do anything, but if you feel like you need to. So we had a doctor evaluate and prescribe antidepressant medication, and dad's mood and anxiety were much improved. And so did his breathing improve. And then I came back and I didn't say, I told you so, because I don't do that, but I kind of, touched base and said, okay, these are the improvements we're seeing. And the son came to visit dad, and dad's mood was completely different. He said, oh my God, I had no idea what a difference this would make. I just thought this was how he always was. And I said, well, this age group, especially, there's so much stigma to mental illness and depression, it goes untreated. And it turns out that he'd had lifelong depression and had electroconvulsive therapy when he was a young man, when it was not being done as safely as it is now. And there was a huge amount of fear for the whole family. So they just never touched anything.
Okay.
So he was much improved. And the son even said, had we been able to put this kind of medication in place years ago, I would have had a different relationship with my father. So it's poignant to me that when somebody with a fresh perspective and different skills takes a look at what's been going on, yes, the family member knows their loved one better than anybody else, but a fresh set of eyes and different skills can offer interventions that were never explored to find something to improve the quality of life. And that's what I'm going for.
But as you know, I'm a financial advisor. So a lot of the things that I look at are from the standpoint of dollars and cents.
Yep. Can
you talk a little bit about the opportunity cost of not engaging a geriatric care manager?
Yes. And there are financial costs. There are other costs. So there's cost to your quality of life, your own personal health care, your own retirement. I'm not sure if this is quite the example you're looking for, but this is what I'm going to share. I have done a lot of support groups in the past, and there was one daughter that came to a support group caring for her mother who was already in assisted living. Mom had some money, but it was kind of a fixed budget. So the daughter, who was probably in her mid-50s, prime earning potential, quit her job to take on being mom's primary care, even though she was in a community, to avoid spending more of mom's money. And I said in the support group, I honor that this is what you're doing. I respect and I understand. However, help me further understand, did she grasp that her own personal retirement finances were now taking a huge hit
Mhm.
because she was no longer earning anything in order to stop and take care of mom. And we went round and round and round, and she insisted she was doing the right thing for her, and that's fine. I just felt bad. It seemed like it was penny wise and dollar foolish to me, that there's no guarantee that any money would be left from mom to offset the retirement by way of an inheritance. In the meantime, she's no longer earning significant money. And she was, working at a good university, had a great job. I think that that's a shame. And I think people sometimes make that is a potential mistake, that they have a high earning potential that they cut themselves off from to meet this need as a caregiver. The cost of that kind of care, while it can add up, these are people who are making $20 an hour versus whatever her salary was. It's not equitable.
Yeah.
It's really taking a financial hit by doing so.
And it doesn't mean that if I were to engage you, that doesn't
Mhm.
mean that I'm not involved.
No, not at all.
I'm managing you.
Right. So one of the points that I tried to make for people, especially when they were trying to consider moving their loved one from home, where they were at home taking care of them, which is 24/7 and exhausting, to a community where people have been trained in how to take care of that person. They have 3 shifts during the day. They have more people there, so they don't burn themselves out or make themselves ill. So I said, it's important to consider that there are other people who do this. Again, you'll know your loved one better than anybody else, but they know what they're doing, and they've been trained in a way you haven't been trained. It just I think it's a sound decision to have the right people doing the right things in providing care. I said, nowhere is it written that you need to give your mom a shower or change her Depends as the primary caregiver, that makes you the primary caregiver. If you're the power of attorney and you're a child, even if you're not the power of attorney, you still get to stay up at night and be worried, and you can still have all the love and anguish. You're the primary caregiver, but somebody else can do the hands-on. You don't have to do that. It doesn't diminish your role. And sometimes people got it and sometimes they didn't.
Well, I hope that anyone viewing this takes your comments to heart and follows up on my encouragement to start reaching out.
Yeah.
I mean, if I'm an adult child, I'm worried about mom and dad, and maybe mom and dad aren't in that position at that point in life. But
right.
Isn't it good for us as a family to have a plan, so that
yes,
if something happens, we know what the next thing is? Listen, parents don't want to be a burden to their children.
I know.
They never want to do that. And
No.
children don't want to feel like they're neglecting their parents.
Yeah,
Yes.
Communication is really key, and it's a difficult conversation. So again, having a care manager who is experienced in the nuances of these discussions can take some of the sting out of it. I definitely have had many conversations about not being a burden. Ignoring the fact that you're aging and you're going to require care.
Right.
Is not a plan.
Right.
It's a choice to do nothing, but thinking that you're not going to plan for something because you don't want to be a burden on somebody actually does the reverse.
Yeah,
when you have no plan, it's a poor plan, but that's the decision you've made. And now your kids have to figure it out from nothing. That's when you're a burden.
Right.
That's burdensome to the kids. Planning and having decisions made and knowing what you want to do and having these difficult but meaningful conversations is not what the burden is. It's a misconception.
Right.
In my opinion.
You're preaching to the choir.
All
preaching
right,
the choir.
good.
So let's go ahead and wrap up this part of our conversation. I know you've got a schedule you need to keep today. Thank you so much for sharing your insights and your
Thanks, Drew.
thoughts
I appreciate it.
and helping to reinforce the message that I hope to get out there. There's, we've got this huge segment of the population that's getting older.
Yeah.
Which is now their children who are getting older.
Yes.
So let's make it easier for everybody involved.
Absolutely. Just have the talk.
Exactly. Thanks
All right.
again, Lisa.
Thanks, Drew. I appreciate it.